Good afternoon, fellow social workers. Today I am going to be presenting my proposal to create a psychoeducation treatment group to support adolescents who have witnessed domestic violence with improving emotion regulation. So let's jump into a brief overview of what this group entails. The purpose of this group, as I mentioned, is to utilize psychoeducation supplemented with CBT techniques to specifically target the needs of adolescents who have been through the traumatic experience of witnessing domestic violence. I set out to create this group recognizing the growing need for intervention within Maricopa County here in Arizona, which I'm going to get into further detail about in the next slide. I've outlined each session of this 6-week program, starting with session 1. That's going to focus on building rapport through an icebreaker activity in which group members will have an opportunity to find commonalities between themselves and each of the other group members. And this activity is really going to lay a foundation for emotional literacy and relational safety that's going to be necessary in the following groups. Then we move on to session 2, where we introduce the power and control wheel, which is a common psychoeducation tool used to help individuals understand and navigate the complex dynamics of domestic violence. But it's imperative that the power and control wheel used in this group be tailored with language that is appropriate for the cognitive capacity of adolescents. Following that, we have session 3, which is going to explore deeper the emotions and body sensations that come with trauma responses. Again, following that foundation laid from session 1. Session 4, we'll get into a visual representation of letting go of negative self-perceptions. Often witnesses of domestic violence will experience lowered self-esteem. So this will be an activity aimed to increase their positive self-perception. Session 5 will focus on building members' emotion expression skills using I statements and building healthy relationships within and outside of the group. And then finally, our last session, session 6, will set members up for success by allowing them to kind of culminate all of the learning from the other sessions and create an individualized safety plan, which will serve as a tangible reminder to use the skills that were acquired here during our group. So as I mentioned, there was some rationale that goes into the creation of this group. So across the US, millions of children are witnessing domestic violence every year, which is linked to systemic inequities, according to research by Slowakowski in 2011. My research showed that Maricopa County displays a similarly large portion of children who are witnessing domestic violence, with the Maricopa County Attorney's Office estimating that a child witnesses domestic violence every 44 minutes within the county. So while adult domestic violence support groups are readily available throughout the county, it's much more difficult to find support groups that are tailored for adolescents. Adolescents who witness domestic violence tend to exhibit symptoms of emotion regulation dysfunction through poor academic performance, school absences, extreme reactive behaviors, poor social skills, deficits in developmentally appropriate hygiene, inability to focus, and challenge following directive from authority. So support groups for adolescents need to recognize their cognitive capacities. They have ongoing development of their abstract reasoning, communication, impulse control, need for independence, and factor in the effects of peer pressure. And so these skills are still developing for adolescents and need to be built into the group to specifically garner well-rounded learning and healing for adolescents. And this comes from research by Zastrow and Hessenauer. And I found that the group setting was the most effective modality of treatment for these adolescents because adolescents need a non-authoritarian form of predictability and structure to elicit the needed safety and security. Psychoeducation was chosen as the primary treatment intervention for this type of support group because Zastrow and Hessenauer argue that it's one of the most effective and necessary forms of treatments for individuals who have experienced domestic violence. Psychoeducation provides an opportunity for information sharing, practice exercises, and reflective listening, all of which are essential components of healing from this type of traumatic experience. But I also wanted to include CBT to supplement this group to ensure negative automatic thoughts, cognitive distortions, and unhealthy behaviors that may be a result of some lowered self-esteem after a domestic violence incident are addressed as well. CBT is also widely recognized by the research of Jalali and colleagues as an effective intervention for anxiety and depressive symptoms, which again can also occur in these trauma responses. However, one limitation is that the group setting may not fully address the individualized treatment needs or factors in emotional readiness of each and every group member. So facilitators should be prepared with referrals for individual counseling if that does become needed throughout the group. So finally, to wrap up, so in session 6, to assess the success of the group in improving emotion regulation through psychoeducation, members are going to receive a feedback card in which they can fill it out anonymously during that sixth and final session. So members are going to be asked to rate each session topic based on how much they feel they learned compared to their knowledge before the group. And they're going to rate their learning on a scale of 1 to 5. So a majority of scores on the feedback cards that are valued at like that 1 to 2 range, which would indicate, man, I don't really feel like I learned very much compared to when I started this group. That's going to indicate that a change may be necessary to ensure appropriate goal alignment. This style of feedback also allows for facilitators to differentiate. Maybe there's one group session or topic that is going particularly well, where we're scoring on the 4s and 5s, versus where are those sessions that may need some adjustment. And as mentioned previously, emotion regulation deficits are often seen in the form of poor school performance or school absences, but the behavioral deficits such as extreme reactivity and difficulty following directives can also cause problems within the school setting. So this group is going to support a reduction of these challenges for school personnel and hopefully improve school functioning overall for our community. It's also going to support the community within Maricopa County, offering a uniquely needed opportunity for adolescents and their families. For example, this group is going to provide a safe and healthy space for adolescents, which is also going to reduce stress on caregivers to find healthy engagement for their children while they need to focus on their own tasks, whether that's errands, going to their own support groups, work, you name it. Also, the reduction in delinquent behavior that comes from increased emotion regulation skills will hopefully create less strain on the local community and law enforcement, getting these adolescents off the street and providing tools for them to avoid those risk-taking behaviors. So finally, here are my references for this presentation. Thank you so much for your attendance, and I look forward to hopefully continuing this collaboration with our social work community. Please feel free to reach out to me with any questions or any interest in joining the work for the psychoeducation treatment group.